Hey Health 425ers, my name is Clayn Smith. I am a senior in the public health science major, and for my presentation I'm going to be discussing sort of a brief overview of vaccinations within a healthcare perspective, current and past pandemics. To begin, vaccinations are a medical method to produce an immune response to various diseases. And there are several different types of vaccines that can promote that immune response. These include live attenuated vaccines, inactivated killed, toxoid, or subunit, each of which deal with different diseases. However, before vaccines were developed, their concept of protecting people from major disease through mild exposure was practiced as early as 1000 AD in ancient China. The practice then involved exposing individuals to smallpox matter from ground up pustules and causing a mild response in the patient, protecting them from the real disease. This process of exposing individuals to live smallpox matter was known as variolation, which was very commonly practiced in the mid 1700s. And from records then, we know that variolation had a considerably lower mortality rate than the untreated disease. At the same time frame, a physician known as Edward Jenner actually helped in developing vaccination from variolation when he noticed dairy workers had no real response to smallpox due to their exposure to cowpox. A little too quickly, he decided to expose a small boy to the cowpox, and it promoted an immune response to smallpox, far more effective and safer than variolation. Vaccines today, however, have considerably more stringent requirements in their development, often taking 10 to 15 years to fully develop and implement them. As a result, they're considerably more efficient than variolation, variolation having a 1 to 2% mortality rate, while modern vaccines having less than one adverse reaction per million doses. These more highly developed modern vaccines have essentially eradicated several diseases, either globally or regionally. These diseases include smallpox, which has been officially eradicated since 1977, some variations of polio, and formerly measles in the Americas, but it has since made a comeback. The comeback of measles to the Americas is often attributed to lower vaccination rates, which can be attributed to higher rates of anti-vaccination sentiment, which is not a new concept. Fear of vaccines dates back to even before Jenner's time, and even ancient China, where emperors were often shouted down by suspicious individuals in their courts. However, today, one of the most influential members of the anti-vaccine movement could be considered formerly Dr. Andrew Wakefield, who published a fraudulent report in 1998 claiming a link between vaccines and autism. Him and other celebrities keep misinformation alive within tightly knit media circles that make it difficult to spread the truth. And the spread of this misinformation within those tightly knit cultures often brings back some diseases formerly thought eradicated, such as measles, whooping cough, and in some countries where vaccines aren't as easily available, polio is making a comeback in the more developed countries as vaccination rates are dropping. A prime example of this would be the 2019 measles outbreak in Samoa, in which vaccine hesitancy caused by malpractice incidents of two nurses mixing vaccine with muscle relaxant caused two infant deaths. The country's measles vaccination rates dropped as low as 31%. The outbreak caused over 5,700 cases of measles in a country of only 200,000 people. Fortunately, the government response was firm and swift, implementing curfews, canceling public events, and cooperating with international medical teams to help raise the vaccination rate to 94%. This example gives us a solid blueprint to determine what serves as an effective solution to ending outbreaks such as the measles or even COVID. Limiting public access points, such as large public events, vaccinations of the population to not only protect individuals but develop herd immunity, and stopping the spread from overwhelming hospital systems. Turning towards the current COVID pandemic, despite a fairly swift development time, the COVID vaccine is showing impressive results at suppressing the outbreak. Studies have shown a reduction of over 56% in COVID attack rate, and this is prior to the vaccine being made available to the public, besides frontline healthcare workers and vulnerable populations. Despite being rushed out so quickly, we are fairly confident that the vaccine is safe, with over 8.5 billion doses given worldwide at a vaccination rate of 46.6%. And it is notable to mention that no significant harmful effects have been detected by such a large international community and sample. With that in mind, COVID's death rate of 2% isn't entirely the only reason one should get the vaccine. It's all about reducing the pandemic strain on our hospital system. While COVID's going around, we're still dealing with all the other medical issues we have without the pandemic. And currently, 87% of our hospital inpatients are COVID related. Out of Utah's 521 ICU beds that are available, 210 of those are occupied by COVID patients who are unvaccinated. Where a metric of having 85% of your ICU beds being full indicates an overwhelmed hospital system, having 40% of those beds being filled by something preventable is an issue. This can be seen as hospitals are no longer in normal operation status. They're in contingency, which means reduced quality of care, reduced staffing, unpaid overtime, and is in light of a national nursing shortage. In light of this, I spoke with Dr. Greg Smith in Morton Plant North Bay Hospital of Tampa, Florida. Recommendations for how each of us can help our hospital systems were fairly simple. Follow sound scientific advice. Get vaccinated, that is. See a primary physician before going to the ER unless it's an emergency. Plan ahead for COVID tests. Don't try and get those at the ER. Try using a CVS or a Walgreens or pharmacy. Schedule it somewhere else. To conclude, vaccinations are essential in protecting us from disease, and when it comes to COVID, we're not entirely out of the woods. There are things we can do to try and help our medical community and our local communities by getting vaccinated and taking time away from public events. These things will take pressure off our healthcare workers and help us get out of this pandemic sooner rather than later.